Hi there, my name is Matthew Messmer. I am a credentialed diabetes educator. I run Astute Diabetes, located in the beautiful Adelaide Hills in South Australia. Now, understanding what can happen when type 2 diabetes is not managed well is considered one of the first steps to protecting your health. So let's start with these short-term problems that can be associated with type 2 diabetes. So the short-term problems, what we consider the day-to-day, week-to-week issues, well, one of the first ones can be a lack of energy. You feel tired. And this is because all the glucose, the sugar, is in your blood, and because of the insulin resistance, well, it's not in your cells. So your cells aren't getting the fuel they need for energy. Kind of consider it like a car that's got a full tank of petrol, but there's a kink in the fuel line, so the engine isn't getting the fuel it needs. Another problem is you can feel thirsty, like really thirsty. And this is because all that glucose in your blood is actually drawing water out of your cells, leaving you feeling dehydrated and, well, an incredibly dry mouth. Another problem is, well, frequent trips to the toilet. Now, your kidneys are trying to play the hero, and they're trying to pee out, or get you to pee out, all that excess glucose that's causing damage in your blood. The problem is, this causes you for frequent trips to the toilet, which is not very helpful, especially at night time when you're trying to sleep. Blurry vision. This is another problem we see in the short term with type 2 diabetes. And what it is that excess sugar, or the glucose around the blood vessels around your eyes, they cause the fluid in your eye lenses to shift in and out, changing the shape of your lenses. And so 1 minute you're watching the telly and everything's clear and fine, and then the next minute, well, everything looks like a Monet painting. Lastly, in the short term, we also see an increase in infections. Now, that glucose is not only fuel for your body, it's also fuel for bacteria and yeast. And so we see an increase in infections in the skin, bladder, and unfortunately, the genitals. So in the short term, when type 2 diabetes isn't managed well, it's kind of like being hungover, but not having that fun night beforehand. You know, you're left tired, dehydrated, blurry vision, you're peeing a lot, and, well, unfortunately in some circumstances, having an infection where you don't want it. So with type 2 diabetes, in the long term, when it's not managed well, this is what really causes the concern for all us healthcare professionals. And to sum it up in one word, it's called glycation. What glycation is glucose, that sugar, in your blood will stick to your cells. And when it sticks to a cell, and this is any cell in your body, it will change the shape of that cell and cause cellular dysfunction. This is what your HbA1c is all about. We're looking at how much glucose has stuck onto your red cells, and we know red cells live for 3 months, so we can get sort of an average of how much glucose you've had in your blood, and we see how much has stuck on to those red blood cells. Now, this happens normally, but as you increase the amount of glucose in your blood, when you have high blood sugar levels, this increases the rate of glycation. And the problem comes is where glycation is a bit like caramelization. Imagine you have a white onion and you put it on the pan and you heat it up to caramelize it. Now, the heat is changing the shape of that onion, making it sweeter and making it go brown. Now, in glycation, it's not the heat that's changing the shape of the cell, making it sweeter. It's the glucose attaching onto the cell that's changing the shape. And funny enough, just like the white onion, you yourself from glycation turn brown on the inside. Here's a picture of bones from various ages as you get older, and you can see it gets brown. So we are just basically giant slow cookers, and if you have higher blood glucose levels, you're kind of increasing the rate you're cooking yourself. You are aging yourself faster. Now, the problem is with this glycation, which is kind of like caramelization, is it's happening in all your cells. So you're kind of caramelizing your eyes, which is why you can get retinopathy with your eyes, caramelizing your brain, which is why dementia rates are so high amongst type 2 diabetes, your heart, which is the biggest killer for type 2 diabetes, and you're caramelizing or glycating your fingers and toes, which is, well, why they can sometimes need removing if it gets quite bad. So that is the short-term and long-term issues with type 2 diabetes when they're not managed well. Now, fortunately, when they're managed well, we can head off a lot of these issues and particularly reduce that glycation. So I highly recommend checking out your health team. And if you're in South Australia, particularly the Adelaide Hills, I hope you'll consider myself as your credentialed diabetes educator. Hope you have a great day.